Hello, this is Alejandro.
We will begin the program in just a couple minutes. We'll wait for others to get on to the program. Thanks for your patience. Thanks for joining us, and we'll be back to you in just 1 or 2 minutes. We will begin the program in just another minute or so as people are assembling. Thanks for your interest and your patience, and we'll be right with you. We know we have a number of people in queue trying to get onto the system, so we'll open the program just as soon as we can get them on. Thanks a lot. Well, we know we have additional people working to get on, but we're a couple minutes past the time of our start. So why don't we get going? Marvin, if you could remove the slide and we will begin the program. Thanks for that. Well, welcome everybody to back to the Council of the Americas. It's a real privilege to have all of you with us again for a program on the Caribbean's response to the COVID-19 pandemic with a specific focus and emphasis on the Dominican Republic. These are issues that are obviously affecting the entire hemisphere. Fortunately, the Caribbean has not yet been as directly impacted as perhaps other parts of Latin America, but we do see some trends that are certainly worth considering, and clearly the economic aspects of this are very significant as well. One need look no further than the number of flights that normally would go to the Caribbean full of tourists, which are now no longer traveling there, and we understand the direct economic impact of this crisis. It's very significant and very serious. This is part of our healthcare series for the Council of the Americas. It's underwritten by Pfizer, Merck, Roche, and Sanofi, and those who may be interested in lending your own corporate support for these activities, we'd love to talk to you about that. Zoe Douth is the coordinator of this series, and would be happy to field those calls. And I also want to thank Maria de Lourdes Despradel for her terrific job of organizing this program this afternoon and pulling it together, and we thank her for her very hard work. Despite what you just heard, all mics are supposed to be on mute, and we'll ask you to keep your mics on mute so that we can have a clear conversation with our special guest. When it's time for the questions and answers toward the end of the program, we'll have the opportunity to call on you and open your mic, and you'll be able to speak and ask the question. At that time, please direct your questions via WebEx chat to Maria Despradel, or you can send it to me directly as well. Please send it privately, or else everybody on this call will be able to read your chat if you send it to everyone. Well, we are also very pleased that the Dominican ambassador to the United Nations is on our call. That's representatives of the Embassy of the Dominican Republic in Washington are on the call, the Embassy of Haiti, the Dominican mission to the OAS, the Dominican mission to UNESCO, and many other senior officials. We're delighted to have all of you with us. Well, the purpose of the conversation today is to speak to Amado Alejandro Báez, who, as all of you know, is the Executive Director of the Presidential Committee for COVID-19 Response, and he is the Public Health Advisor to the President of the Dominican Republic. He is somebody who comes to these issues with a deep background in public health. He is a true expert on these issues. He was born and raised in the Dominican Republic. He's considered an influential emergency care leader, and he is indeed on the board of directors of the Mayo Clinic Alumni Association. He holds fellow status from multiple distinguished medical institutions, and he co-founded the Harvard Operational Medicine, and he's currently the director of the Center for Operational Medicine at the Medical College of Georgia at Augusta University. He has over 20 years of experience in the planning and training and support of disaster and operational medicine medical endeavors, working with local, federal, state level government officials in an operational capacity. He also coordinated the response to the devastating 2010 earthquake that leveled parts of Haiti. And he has just done so many other things, including authoring over 100 articles in scholarly publications. So, ladies and gentlemen, we have with us a true expert on these issues and somebody who has agreed to come talk to us about the Dominican government responses to COVID, some of the planning going forward. Dr. Báez, we know it's a difficult time given the fact that despite all of this happening, it's in the midst of a presidential campaign, and there's so many other things going on. And so we look to you for some comments, some insight. And with that, ladies and gentlemen, please join me virtually in welcoming Amado Alejandro Báez to the Council of the Americas. Dr. Báez, over to you. Please unmute.
Oh, good afternoon. Thank you for the opportunity. Can you guys hear me okay?
Yep, you're good. Go ahead.
All right. So I was asked to give a little bit of a summary of some of the work that we've been doing. I'm honored to be given the opportunity to talk to such a prestigious group. And so for me, it was kind of an interesting call. I've been working emergency care for about 28 years. I joke that I hopped on an ambulance when I was 18, and I'm still riding an ambulance, full sirens and lights. Um, I'm born and raised Dominican, and when I look at my path, it's kind of an amazing privilege to look back and reflect on some of the opportunities. Being the first international physician to graduate from the Mayo Clinic Emergency Medicine residency, training with the Harvard system in critical care. And a lot of those things kind of led to the person who I am today. So I've been working emergency disaster care for 28 years. I've done it in the Dominican, I've done it in the US. A big opportunity that we had to do some good was assist in some of the humanitarian efforts in Haiti. Actually, I had just returned to the Dominican a few months before that, moving from Boston to Dominican to run some academic and professional endeavors in the Dominican. And literally, I was on a plane in the Miami airport tarmac, January 12, 2010, after completing a fundamental disaster management medical course in Miami. So I had just completed a disaster training program, January 12, 2010. And then we did a lot of good. We opened some nice efforts in the border, Dominican-Haiti border. A lot of the stuff we did was articulated with the Harvard groups. And even the United Nations took note of some of the things that we did in Haimani and on the Fond Parisien on the Haiti side. And after that, my life changed somewhat because a lot of my focus was on disaster critical care services, serving on various committees and writing papers on how to deal with pandemic flu, how to do capacity augmentation in pandemic scenarios. And I was, doing my thing in Augusta, Georgia, about a month ago. I was working COVID, obviously working some community programs and working some emergency care programs. And I was actually leading the critical care augmentation efforts for the Augusta University Health System at that time. And I got a call. And on that call, they asked me if I could help in the Dominican. I wasn't quite sure what that meant. And ultimately, what that meant is that I was going to be appointed special advisor to the president of the Dominican, and I was going to be appointed as the executive director of the COVID task force. So this is about a month ago. An amazing privilege, obviously, being able to come back to my country, the country that saw my birth, and be able to help and assist and build programs. And but somewhat of a unique challenge because things had already started in the Dominican a month ago. Also a little bit of a challenge because the committee was basically developed a month ago. So it was not an existing entity, it was not an existing organization. And a lot of what we've done over the past month has been understanding where our place is, where we fit. And when I reflect back on the month, basically what we have done is connecting. We've looked at what are the opportunities, what are some of those gaps that we can help fill. So even from the get-go, one of the things that I thought would be interesting and unique was to create public-private partnerships. And we started looking at how that would materialize in the Dominican, understanding that you have a unique environment because of elections. You have with elections, you have a very tense narrative and a very tense social environment. And when we started shaping up the efforts, we thought, hey, what if we look at this public value concept that Mark Moore has been teaching about at the Kennedy School, the Harvard Kennedy School. And what if we turn it into a public value in crisis model, where basically we build services with a public-private partnership, and those services are directed at achieving the same results to the overall population, independent of socioeconomics, and then integrating those results with feedback from the community so we can actually guide our interventions a little bit more targeted and also create that trust. So the concept started with, let's build a public value model and let's call it public value in crisis. And we started looking at, well, there's a lot of talks about the curve, the epidemiologic curve, and there's a lot of talks about what the curve means and flattening the curve and the peak of the curve. And one thing that we understood is that the curve obviously represents the number of patients at any given time point. But the reason why we want to flatten the curve is because of the capacity of the healthcare system. And now we're dealing with, can we do epidemiologic prevention and mitigation strategies while at the same time we address capacity building strategies at the public and private systems, with the public and private healthcare systems. So we started shaping up these concepts and understanding priorities and how we should look at flattening the curve. And one big component of the plan was obviously to increase testing so we could have a finer pulse on the epidemiologic profile of COVID in the Dominican. Clearly, that has become a challenge everywhere, and maybe we'll talk a little bit about that. But then looking at how do we unify the country? How do we create a system where even in a tense political environment because of elections, we send a message that we're all in this together. We send a message that whether you work for government or whether you work for the private sector or whether you work for an opposing political party, which is interesting because we had local elections a few months back, and we actually have about 81 mayors who are from the political opposition. And one thing that we understood is that all these things that we're doing to flatten the curve and to have a better pulse on epidemiologic profiles and capacity building, it means nothing if you don't look at it at a local level. So one thing we realized is that this public value in crisis model needed to be necessarily implemented in a synergistic public-private way, but also implemented locally. So somewhat of a bottom-top approach. So we create general directives, but the actual implementation needs to happen at the local level with the local governments. And at one point, another thing that we thought it would be interesting to do was to create an epidemiologic intelligence fusion center, and we'll talk a little bit about that. But one of the things that presented, one of the opportunities that presented, there was this province called Duarte. Duarte is the name of the founding father of the Dominican, Juan Pablo Duarte. Duarte, the main city in Duarte is called San Francisco de Macorís. And San Francisco became a hot spot for COVID. A lot of cases, a lot of peaks, a lot of mortality. When we reflect back, a lot of the chaos in San Francisco had to do with the fact that the local government became ill with COVID. So the governor and the mayor became ill. And then about a week to 10 days before we intervened on San Francisco, there was a transfer of powers of the local government. So there was no actual ownership from the local government standpoint. So at the same time, in a very organic way, we had an entrepreneur, we had a business person who has a lot of efforts right there in San Francisco. His family owns cacao, chocolate factories, and plantations. And one of the things that we did was to create this business council. through Hector and Samir Risek. And the idea was that a lot of private efforts, a lot of philanthropic private efforts wanted to help. And we felt that if we created this public value model with public and private partnerships, but it needed to be based at the local level, then the corporate social responsibility and philanthropic efforts probably made more sense if they happened also at the local level, because that way business people that actually had a vested interest in the community could invest in their own community and could in different ways get a return from those philanthropic investments. The other value added there is that those local business people have ties with the communities, so they were able to connect us with all the key actors and all the key players. So in a very organic way, we started shaping up this public value and crisis model. We created a business council with entrepreneurs and business people that would help us with some of the philanthropic efforts. We integrated the private healthcare entities with the public healthcare entities, and we launched the program about 3 weeks ago. At the time we intervened, San Francisco, it had the fastest growing rate of COVID, one of the highest mortality rates in the country. And we did it in a very cohesive way with the Ministry of Health, with the National Health Service, with the Dominican military, with the Center for Emergency Operations, but also integrated with some of those private actors, looking at, let's do testing so we can have a finer epidemiologic profile, but let's also look at capacity building and augmentation for the healthcare system. Let's look at issues like popular markets and how they get crowded, not because people just want to hang out at the popular markets, but because families need to feed their families based on the supplies that they purchase at the popular market. So let's create solutions at that level from a supply and demand standpoint. Let's work with food banks and distribution centers. And let's look at things like mortuary services. COVID creates a very difficult death. People die alone. Families don't get the chance to say goodbye to their loved ones. And often in our countries, even funeral services become a problem. Funeral directors don't want to see COVID patients. Cremation is not part of our culture because of some religious beliefs, even though we work with the Catholic Church addressing that. So one of the things that we did through this relationship with business people, specifically the Risek family, we called a funeral home and a cemetery. And the Risek family said, you know, we will take care of all the funeral services for free, so that nobody in San Francisco and Provincia Duarte has an issue with losing their loved ones. And now on top of that, they have an issue with actually arranging funeral services. So the pilot was a very interesting experience. Obviously, you set up a program and you have to fine tune it. You have to learn some of the things that you can do better. You have to learn some of the things that actually are not working. So another thing that we created was a virtual town hall system with social leaders. We included religious leaders, business people, press. We actually had a dedicated press group that we did virtual town halls every week. And they gave us feedback in terms of the things that worked and some of the opportunities and the things that could be done better. So we implemented Plan Duarte, was the name of our pilot public value and crisis model. And the great news is that last week, in a very spontaneous way, nothing that we fed the media or the press to, the press published that for the first time in many, many weeks, the ICUs in San Francisco had no COVID patients. This is about 2 weeks after we implemented Plan Duarte. This week, actually yesterday, the news published that the rate of new cases and mortality associated with COVID in San Francisco has been the lowest since March, since the beginning of March. So obviously something worked with that model. We actually learned some of those lessons and we implemented those ingredients of the business councils and the public-private partnerships in other efforts that we started in Santiago, the second largest metropolitan city in the Dominican Republic. We were just this weekend in Puerto Plata, where we had a little bit of a social unrest situation with a march that shouldn't have happened, and we were concerned about increasing cases there. We reproduced the model here at the central region, and we're actually launching it in 2 days in Santo Domingo. We're launching it with the mayor of the city of Santo Domingo, the first female mayor in the oldest city on this hemisphere, Carolina Mejia, who happens to be a member of the opposing political party, not a member of the central government. And we're doing this partnership with her ayuntamiento, with her office, where we are replicating the projects, the public value projects that we implemented in San Francisco, Santiago, and Puerto Plata. We're doing this in Bani, a smaller area, less dense, and Altagracia, where we have Punta Cana, the famous touristic center. So a lot of these things, a lot of it is just learning as we go, learning on some of the opportunities. So the committee kind of became this glue where we just capitalize on little opportunities, from protocol writing to connecting public and private efforts, to giving entrepreneurs and philanthropists the opportunity to actually be able to invest their philanthropic efforts in a very palpable and tangible way, as opposed to just donating money and not necessarily seeing materialize some of those efforts. My office has nothing to do with money, which is something that I should probably say. When we were negotiating my position, one of the things that I purposefully requested is that I needed to have authority and autonomy, but I also needed to be not paid by the Dominican government. So the negotiations made were basically the Dominican government with the state of Georgia, that happens to be my employer, where the state of Georgia loaned me to the Dominican. This was purposefully done so because I couldn't allow the normal mechanics of hiring a consultant expert paid would probably be used in a political narrative to taint my efforts. So I needed to get that out of the way so I could actually focus on the things that we needed to do objectively and without any noise. So a lot of those things, we built from the beginning. We've done a few interesting things. We've been connecting different efforts. We've been looking at the use of technology, which is the last thing that I wanted to mention. One of the things that we realized is that the country needed a little bit of a technological injection, and we had this amazing talent, a tech IT engineer called Rainier Mayor, who was working on COVID technologies in Malaysia. Dominican guy working on COVID technologies in Malaysia. He came back and he worked with us. In 10 days, we built a epidemiologic intelligence fusion center, integrating 12 different IT platforms, from reporting data of lab results to integrating a web service, connecting 12 different platforms that would actually provide geo-positioning of each of the positive COVID patients, connecting those patients with availability of isolation beds, non-hospital isolation beds, which we have about 4,000 of those, connecting patients with hospital beds, ICU beds, ventilators, both on the public sector, and a few dozen of the private clinics are also on board with this effort. And part of that integration of platforms and data allows us to do predictive analytics. And through those predictive analytics, we can pinpoint with predictor models, and obviously the mathematical models are heavily dependent on the quality of the data, but we can actually pinpoint opportunities in terms of 8 to 12-day forecasting at the local level, and assess whether we need to do more preventative interventions at local municipalities, or whether we have to do capacity building efforts with an 8 to 12 day window through the data analytics that we have. This fusion center also integrated NGOs, international organizations, and it was interestingly built on the C5I, the military main cybersecurity and intelligence center that had not even been opened. It was brand new, not opened, and the president of the Dominican said, "Hey, I think you need to talk to the Ministry of Defense and look at this new facility." And via that new facility and the IT resources, we created the first Intel Fusion Center in the country, and that's feeding us nice data. We're deploying 150 home visit units that are integrated from the National Health Service and the military, and basically guided through the data that we collect on the EpiFusion Center. So we're doing home visits, and in the process of doing home visits for COVID patients, we had an aha moment about 10 days ago, and we realized we could do chronic disease management, population health, and preventative measurements on patients with diabetes, heart failure, pulmonary diseases. More like if we are able to control these chronic illnesses and we don't have acute exacerbations and the healthcare system can be decongested, but also if they happen to get COVID and they're not properly managed, and they're probably going to get sicker. So let's just look at population health and preventative medicine. And at that time, we've been struggling with the launch of our primary care system. And we realized, listen, maybe this is what primary care is going to look like in the Dominican after COVID. Maybe
We lost your audio, Dr. Báez. We lost your audio.
Also look how crisis suffer, not allow the suffer, distract us from making better. Maybe even directly as an effort of honoring those who have lost their lives and their loved ones by COVID. So my main goal is to work at making the healthcare system better in the long run. And that means more labs, more tests, better primary care, better technology. And it's one of those things that COVID kind of makes you think of almost like the power of now, Eckhart Tolle. But I think we need to look beyond the now. We need to look at what are the other things that we need to be addressing, not only because it's the right thing to do for the healthcare system, but also bearing in mind that we're probably going to have a second wave in the fall or winter. And everything that we do now needs to be necessarily focused on how can we have a stronger, faster system, more efficient system, so that if we get that second wave in the fall and winter, it's not like that second wave in the 1918 Spanish influenza pandemic, where we can actually build a better system, and that second wave actually make it milder and not as potent as we're seeing now. So I'm gonna stop there. I think I gave a little bit of a summary of some of the main things that we've done: public value in crisis, the Intel program, the deployment of some of the testing technologies. But I think I'm going to open it to questions, and I'm happy to answer any questions that you have.
Dr. Báez, thank you very much. That was terrific, and we've got about 15 or maybe 20 minutes to get to some of these questions. I'm going to ask the first one, and then I'm going to go to Cecilia Sanchez for a question. And Cecilia, your question was actually one of the ones that occurred to me, so I'm glad you're going to ask it. But before we get to that, this fusion multi-sectoral approach, I think, is really interesting. And it's one of the things that people continue to point to in terms of the regional perspective, right? There hasn't seemed to be a lot of effective coordination this caught a lot of people by surprise, maybe humanitarian response in the past for hurricanes and things like that. There's regional bodies and organizations set up to address, but not really perhaps on the health side. I wonder, Dr. Báez, does this model that, and I know it's very new, it's still, in its infancy, but does this model provide perhaps the ability to scale up this sort of coordination in the Caribbean basin, or is this really just a Dominican unique model that doesn't really have applicability more broadly? Do you have any thoughts on that?
Question. Can you hear me now?
You're in and out.
How about now?
That's good.
Okay. What was the question? I'm sorry, I couldn't.
Well, basically the scalability of the Dominican model that you've talked about, is it broadly, could something like this be expanded to the Caribbean basin broadly, or is it really based on unique characteristics in the Dominican itself?
Yeah, I think it's I think some things can be generalizable. I think the validity of the model, just looking at the main core, public value with public-private partnerships and services, generating results, integrating the community, all those things can be easily reproduced, I think. One important thing to understand is that the Caribbean is very complex and very different. We share the same island with our brothers and sisters from Haiti, but Haiti has a very different socioeconomic structure and healthcare system that I'm not sure that a lot of things that we do can be reproduced there. And then you have some of the European, former European and current European colony islands that actually have socialized systems. And within the socialized system structures, things can be done differently. But I think overall, the general message is public-private partnerships, public value concept, results for the general population independent of socioeconomics, working with local governments, not just setting directives from the central government, working with your local partners, both at the government and at the social level. Social leaders, press, at the local level are the ones who are going to help you be successful, and local entrepreneurs and philanthropists. I think that ingredient itself was gold for us.
Yeah, I think that's a really key point, and particularly given your mission, which I think is entirely appropriate, that coming out of this pandemic, that the system itself be improved over time, and looking for best practices and ways to improve things. I think that's really important. So thank you for that. Cecilia, we're going to go to you. Cecilia Sanchez, please unmute your mic, identify yourself, and ask your question.
Thanks, Eric. My name is Cecilia Sanchez. I work at the Miami Herbert Business School. And my question is related to precisely, it's a perfect setup for my question, which is about precisely the local business councils that you mentioned were created to support a lot of these local kind of based activities from the public health perspective. And so my question is, have these councils been working, and if so, what are the measures they've been working on with regards to the economic impacts of COVID on the economy in Dominican Republic?
Yeah, and that's a fantastic question. And it actually became a very natural progression of the things that we did. So we started with the local business councils more as a way of saying, hey, you want to donate stuff? We feel that it's better if you do it at the local level. And by the way, in the process of doing that, you can help us connect with the key stakeholders that you already know because you have roots in that particular community. But in a very organic way, we started realizing, hey, opening the economy, which and I think, I was hoping to talk a little bit about public health and economy. I'm a public health guy. I'm a medical guy. My economic knowledge is very basic, but I've learned a lot over these weeks. I think I've done a master's in politics, diplomacy, and psychology, by the way. So I think I've earned my master's in psychology in these 4 weeks. One of the things that my office sits at the Ministry of Economy, not at the Ministry of Public Health. And it's been purposefully done like that because that way it allows us to have a different integration with government perspectives. The committee that I direct has a strategic mandate, a policy mandate, and an operational mandate. So it's important for me to understand that side of the world, because it almost seems you look at that McKinsey, it almost seems, or one of those many McKinsey publications, it almost seems that people are saying that it's a fight between public health needs and economic needs, right? And Hausman from the Kennedy School did one of the first publications looking at how flattening the curve actually affected macroeconomics, right? And on top of that, the whole economic shock with supply and logistics chains being affected, and how does that actually affect local economies? So I think that ultimately there's a little bit of a trade-off, right? So an absolute public health orientation will most likely affect the economy not very favorably, right? So social distancing, physical distancing, quarantine, all those things affect the economy. So one of the things that, to go back to your question, one of the things that we started realizing is, hey, ultimately, whether it's in a week or whether it's in 2 months, we have to talk about opening the economy. And that economic opening has to be phased. And we need to intelligently understand what segments of the economy can be opened, whether it's based on productivity, whether it's based on expansion of essential services, whether it's based on safety. The other interesting thing about COVID is that we can learn from experiences, right? I'm not sure, and I live in the state of Georgia, and I am very grateful to the governor of Georgia for allowing me to come to my country, me being a Georgia employee. But I'm not sure that the economic opening strategy of Georgia, opening tattoo shops, barber parlors, massage shops, and bowling alleys, had that intelligent approach of economic segments that needed to be open, right? In terms of productivity and in terms of decreasing risk. So inevitably, because of your question, we started realizing, hey, maybe we should be having these conversations with the local business councils and asking them, how do you see the economy being open at your level? What are the things that you see? And a lot of interesting discussions have happened. I had a meeting last week with the Banking Association as well. I cheated a little bit. They actually wanted to talk about public health interventions in their banks, like washing hands and which masks to use. And I'm like, you know what? I don't think I'm ever going to have a meeting with the top 10 presidents of banks in my country. So I'm just going to pick your brains. You tell me, how do you see the economy being opened and what are the interventions? And so it ended up being more of a discussion of me picking the brains of 10 banking presidents and their point of view of economic opening. So absolutely. So I think that what I try to do is learn as much as I can from these experiences and capitalize on valued moments, like talking to the business councils, talking to the hotel industry association, talking to the banking associations, and learning from their perspective, what are their concerns, but also learning because everybody is worried. So they do their own research. They Google stuff, they talk to their counterparts in Asia and Europe and the US. And that is the easiest and most effective crowdsourcing method. You have a town hall with business leaders, with banking leaders, with hotel and tourism industry leaders. And in the process, half of that conversation is allowing me to become smarter and understanding better their perspectives. So we've had those conversations. We've had the conversations about how does opening the economy in Santiago would look like, where they have a big, construction industry, and they have free zones with textile and some food-related industries, and even talking about, hey, how do you see repurposing some of your industrial goals to supply essential services. So you make uniforms. How about now making masks and PPE for the immediate future as it relates to repurposing your goals? So that's kind of how those conversations have been flowing. But absolutely, it's an amazing opportunity. And we have 1, 2, 3, 4, 5. We actually have 7 business councils that are active in different locations. Another one, interestingly, hotel and tourism industry. Mr. Frank Rainieri, he's the father of Punta Cana. And he talked to us and said, hey, I don't think tourism is ever going to be the same. Tourism is not going to be the same in the Dominican. So we need to start looking at disrupting tourism as we know it and maybe making it as tourism was in the 80s, which was internal, domestic tourism. So maybe the repurposing of that productivity sector in the immediate future means how do you actually create a domestic and internal tourism platform? That on itself connects with opening other economic lines. Because if people are not making money, they don't want to go on a weekend vacation to Punta Cana or Puerto Plata, right? They're gonna purpose their money to feed their families. So a lot of those things kind of connect to each other. And what I like the most from my standpoint is that I am able, and I'm a clinician. I'm a day-to-day ER doc. I'm an intensivist. I see patients. I treat patients one at a time. And for me, the biggest challenge is understanding the big picture, and also understanding the impact of some of these conversations and interventions, because it's not really, and people who know me, they will often see me asking them, it's like, hey, what do you think is going on? Do you think we're doing a good job? Do you think things are working? Because I am more in tune to see the direct effect of interventions on patients. And some of these public health macro interventions, I actually have to do these consults with organizations and even friends just to understand how things are going. But not to segue. I hope that answers your question.
Dr. Báez, we're at the allotted time, but let's extend for just a couple more minutes if you're willing to do so. There's a question that we actually have several questions. We're not going to get to all of them, but the question has come in really interesting, and it's probably a pretty short response. But the Dominican Republic just recently recognized China, and have you seen, from the healthcare perspective, any particular interest from China to try to help alleviate some of the issues, or is that just not really an issue at this particular point that you've seen?
Yeah, so purposefully for me to do my job, I try to avoid political traps. I think the China conversation can turn into a little bit of a political complicated trap. However, I do want to say that I have, not directly, but I have been tracking the Chinese ambassador in the Dominican Republic, and he has been very actively engaged in a lot of different assistance and aid processes, none of which have been directly linked to my committee, but I know there are some humanitarian efforts are coming in from China.
Yeah, no, thank you. A question in terms of what, from somebody who just asked that I would ask it, so I'll go ahead and do so. What have you seen at the local level that's working the best, and what's not working so well? I mean, a lot of this is experimentation, of course. What are you finding? Is it disinfecting? Is it public spacing? What is it that you find is most effective that could be replicated?
So, there's a McKinsey publication that looks at 23 essential public health interventions, and it goes all the way from like wearing masks to social distancing. I actually like that matrix. For me, the thing that has worked the most is engagement, is making sure that we send the message that we are all on this together. Independent of political party, independent of socioeconomics, independent of whether you work for government or not. That has been the most gratifying and impactful thing I've seen. And I'll give you an example. In San Francisco, in Duarte, we had some, some civil disturbances, maybe from a political nature, but maybe from a legacy. In Latin America, there are a lot of organizations that feed on civil unrest. And in San Francisco, 10 days after we started, they started burning tires because they wanted tests. But we had sent 2,000 tests the day they started burning tires. And it was the same community in San Francisco that dissolved and mitigated and criticized and literally put out those fires. We only had to do our job, and the community and the press leaders and the social leaders were the ones who felt united with us because we had built a relationship 2 weeks prior. We had engaged them, we had listened, and they're the ones who were like, you know what, this is embarrassing, you're not gonna do this. Put those fires, literally put out those fires, and let's work together so we can get the same results. To me, that's the main thing. The biggest challenge, things are not necessarily optimal. Testing is one of those, right? And I think it's important to talk about testing in a developing country. We don't produce reagents. We don't produce rapid tests. We have to import those. The economic shock affecting supply and logistics has made it very difficult for us to get those things. The America First view and not exporting COVID-related supplies from the US has also affected us, even though we are working really closely with the US Embassy. But Roche and Abbott are US-based companies, and they're the main ones who produce reagents. So that has also been challenging. We know that producing a great number of tests is what we need to better understand the epidemiology and to better have a pulse and to better address public health interventions. But that has been very challenging because every other single country in the world is competing for the same things that we need right now. So that's kind of my good and maybe not so good.
Yeah, and those issues that you've just pointed to, I think, are exactly right. We just did a program last week, in fact, on supply chains in the medical space, whether it's pharmaceuticals or medical products or what have you. And the issues you pointed to are real and hopefully will be reduced. But, if you're a smaller developing country like the Dominican or like many of the Caribbean countries, this is a reality. I mean, how do you physically get the products that you need? It's not necessarily knowing what to do, it's having the ability to do it. So I think that's a very important point you raised. I wish we could continue this conversation. We're already beyond our time. Clearly, there are other things we could discuss. Dr. Báez, I hope we'll come back to the Council of the Americas at some point, whether from the Dominican or from Georgia or from somewhere else. Now that we're in a virtual reality, we can have a meeting from wherever you are. But this has been really interesting. You've pointed us to a lot of information, and I think you've left us all in a good way wanting more information. So thank you for that. Thank you for your expertise. And frankly, thank you for your service to the people of the United States and to the Dominican, to Hispaniola. They're really important times, and it's good to have such qualified people on the front lines. Thank you.
Oh, no, I immensely appreciate the opportunity. And absolutely, whenever you guys need me, just let me know and we'll coordinate a few more minutes, 45, 1 hour, whatever you need. Because every day I'm learning more and every day we're doing new things. And I value, this is very gratifying to me, very gratifying to me. But I also feel that it's also a duty to communicate these things and to let others know some of the things that we have done that are working. Because maybe other countries, other folks are struggling with the same type of problems, and being able to offer some solutions is important. When I say we are all on this together, it's not just Dominican, it's the whole world. And the way I see it, the world kind of needed a reset. Unfortunately, COVID became that reset with a lot of suffering and a lot of death. But if we don't see the opportunity of being better, being more united, changing our social currency from money to more social values and understanding the value of collaboration and working as a society, if we don't see that opportunity now, I'm not sure that we're ever going to see it. So I think this is an amazing opportunity, and I want to thank you and hope that we can have a second conversation soon.
Well, you got it. We'll make a date of it. I want to thank again our sponsors for making these activities possible. I want to thank all of you for joining us, as well as the several hundred people we have watching on live stream. So this has been a very successful event. Dr. Báez, thank you again. With that, ladies and gentlemen, we will conclude our program and continue to look to the Council of the Americas for additional information in this space. And if you have ideas or thoughts in terms of things that you would like us to be covering, focusing on, or bringing attention to, please do not hesitate to contact us at your convenience. With that, our program concludes. Thank you again, Dr. Báez. Thanks, everybody. Have a terrific day and rest of the week.